Hi. So in this video, we're going to talk about osteoarthritis of the knee joint. And I've brought my friend the knee along for us to share the journey. Um, I see this a lot, and I know it's a huge problem for many people. And so some of the questions I get asked are, what can I do about it? And because it's osteoarthritis, there's a lot of belief that there's nothing you can do to do about it. You can't make it any better. You can't slow it down. And lots of people think that the only answer is to have knee replacement surgery. But if we looked at the how many people actually got arthritis and don't have pain, if we looked at the amount of people who have arthritis and have pain and never have surgery is not an inevitability, but it will feel like that because, of course, you meet people who've had surgery and they talk about it. You don't meet many people that go around talking about their arthritis and they made it better. They just don't think about it anymore, or it doesn't affect them from day to day. For instance, I saw somebody today who she was in her late 70s, and she came to me with her husband and she said that she's got a little bit of pain in the knee. And I said, "Oh, what's made you come along now?" And she said, "Well, they'd been away on holiday and she'd done a lot more walking. And she must have been saying it was sore because her family had said, 'Mum, you need to, and Nanny, you need to get this knee sorted.'" Anyway, she goes, "It's not that bad." Anyway, she stood up and she couldn't straighten her knee at all. So you could see it as arthritis and it's changes shape. And she probably had, if you talked about 20 to 5 degrees of bend, so it's quite a bit of a bend. But all she wanted to know was, what was it? And could I help her a little bit with the pain? And so if you'd see that, I'm going to get it x-rays, but if you saw that and looked at it, you think, oh, she must have been in loads of pain, but she's not. She just has a bit of pain that does affect her. And what was more for her was, is it arthritis and what can I do? Now we don't think that we x-ray everybody who has osteoarthritis. We don't. And I'll come to that in a minute. So here is a knee joint. Happens to be a right knee. This is the front of it. This is your tendon, patella tendon. That's the patella, the kneecap that sits underneath it. Can you see that? All right. Attaches onto the tibial tuberosity. That's sort of the bony bit you can feel below your knee. Your quadricep muscles, which are the muscles at the front of your thigh, sit here and they merge to become this tendon. So they have a massive influence over the knee. That's when your ligaments, the other side, they're called collateral ligaments. That's the outside lateral. That's the inside, the medial. And you can see it's much bigger and more stable. Now, I can't really take this off completely, but I'll show you from the back. That represents the cruciate ligaments. Okay. Right, the one at the front. There, can you see? Inside your knee. I'm going to try and get that so you can without ruining my there. Can you see? Sideways on. And one of them stops the anterior, which is the front one, stops your thigh moving forwards on your knee that way, and the back one stops it moving backwards on the knee. So they provide you stability, structural stability in your knee, along with the ligaments, the capsule all around it. Sorry, I'm speaking fast, so hopefully you might have to rewind if it's too fast. That this is your thigh, femur. This is your tibia, your shin. That's your fibula, your outside of your calf. And this is a joint, this is a joint, this is a joint. Inside, can you see here these plastic bits? I'm going to try and see if I can get them off so you can see a bit more. Yeah. And then if you can see, but they're up there, it's because it's white, but they're crescent shaped. So they sit like this inside the knee, like that. Oh, it's come off a bit. Maybe I can get it off. Yeah, there. All right. I'll show you. Now, your knee is brilliant, like so many other joints. But when you bend and straighten your knee, as you come up into straightening, the knee rolls inward slightly, okay, to create stability. So that's your closed pack position, and it rolls outwards as it straightens and bends. Sorry, as it bends. That means the inside cartilage, meniscus, right, is slightly bigger than the outside one. You've also got cartilage behind the knee, on the kneecap, and on the surfaces of your knee joint. Now, meniscus inside allows, helps with forces, so it spreads the load across the tibia, which is the bottom bone. It also feeds the joint, keeps it healthy. It feeds the cartilage, which sits on either side of the bone. And inside of that, you've got synovial fluid, which is like, when you first start moving, it's quite what we call fixotrophic. It's quite thick. It becomes a little bit more pliable when you walk. And that keeps the health of the joint as well. That feeds nutrients. The meniscus inside your knee is also important in feedback. So where you are in space and a bit for balance, it's really important. That it's called proprioception. Now, in a normal knee, as we get older, it's natural for the meniscus inside the knee to get a bit thinner. Okay, and obviously you're going to get some wear on the cartilage, but it doesn't necessarily need to be painful. And while I'm thinking about it, when people say to me, my joint cracks or it feels like walking on snow, that's normal. And if it doesn't hurt, just take no notice of it. It's maybe unpleasant, but it isn't, doesn't mean anything. So it all gets a bit nicely a bit thinner. But when we come to osteoarthritis, there's loads of really good research that's come out very recently that offers a lot of hope for people with osteoarthritis. Now, for starters, it used to be that people used to think it was just wear and tear, but now they know it's a mild inflammatory process in your body that can affect any joint. Okay. We also used to think there was nothing you can do about it, but you can, because it isn't just this mild inflammatory process. You also get pain by the kind of things that go on in your life, your thoughts, your environment, and believe it or not, the food you're eating, your gut. Okay, so all of those contribute towards your pain and the inflammatory element. So what happens to the structure of a knee when you get osteoarthritis? Well, you can get excessive or more thinning of the meniscus. You can get much more thinning of the cartilage on the top of the bones. The joint capsule surrounds it can stretch a bit. And I keep trying to smile because I look very serious. And you can get extra bony growth. So the surface of your bone doesn't stay quite as smooth as it was. And it's all of this in combination, plus the inflammatory element, that can create pain. Pain happens for multiple reasons, but and you get a little bit of swelling in the knee joint, that can create pressure pain. The inflammatory element can create chemical stimulation, so pain. And the mechanical change in the wear and the stretch on the capsule can create pain. One of the biggest things, which I think is absolutely incredible, is that they now know that your gut and the foods that we eat really affect the osteoarthritic process, the inflammatory, and that you can actually now can reduce that by eating foods that are anti-inflammatory. Now, I'm not a nutritionist. If you want to look at those types of food, please choose a sensible site, a qualified nutritionist. Okay. And if you want, I do know someone who's in our group, my free Facebook group, and I'm sure if there's enough of you, if you went in the group and said, yeah, Jenny, or posted under this, we'd like to know a bit more about the foods, then I could probably sort something out for you and we can work together on that. The other thing is that I get a lot, okay, is exercise doesn't work. 100% it does. And it doesn't matter which stage of osteoarthritis you are, early, mild, moderate, severe. Exercise has absolutely been shown, I'm really tired, I've had a long day, shown to help. Because without all this, guys, you're just a bunch of bones on the floor. Your muscles hugely affect how much support you get from your joints. So if you think that the capsule surrounding the joint is affected and becomes a bit stretchy, then you're needing your muscles more. And also, we need to get the muscles around the hip to work better, because they make a difference to how much control when you're going up and down stairs, and when you're balancing, they influence the control and the position of the knee. So it's great to do bend and straighten the knee and straightening your quadriceps at the front of your thigh and your hamstrings at the back, but actually your calf needs strengthening for walking, but the hip muscles need strength as well. It's a whole limb thing. Okay, so don't give up if you've just tried a few bending and straightening or stretching exercises and think it doesn't work, because it does. And my favorite saying now is, just because you've tried one type of exercise or one type of regime doesn't mean to say it doesn't work. That's like saying you're taking paracetamol and no painkillers work. You've got to just find what's right for you, and we're all individual. So if you are thinking about, so one of the questions I get in my job is, what else can I do? Now, there are a couple of other things that we could consider. If someone's really doing their exercises and they're concentrating on the food and eating better, and guys, I don't look at people and think, oh, just lose weight, it's going to work, because it doesn't work like that. We've already talked about the fact that there's multiple other factors into this. But yes, you know, multiple times of your body weight goes through your knee when you're walking. So losing even half a stone would make about 2 stones difference of the pressure through your knee. So, you know, weight is a contributing factor, but you can also, if you were coming to me and said to me, the pain's bad, what would I do next? Now, if I suspected you had arthritis in your knee, osteoarthritis, then, and I did all the testing, I might consider doing an x-ray, but we only x-ray if we are going to change your treatment plan. So we won't x-ray just to see if we're right or not, because we've been doing this a long time, and we do know when someone's got significant change in the knee, we're usually pretty sure. So we would x-ray if we were considering changing our treatment plan. And those two things would be, if we were considering a cortisol injection, so a steroid injection into your knee, then we would have to x-ray to make sure it is osteoarthritis and nothing else. Because of course, lots of things can cause knee pain. So we might consider that, and that's something else that you could talk to your doctor or your physio about in the GP practice. If you're doing all your exercises, if you're looking after your diet and taking over the counter pain medication that's not working, it is an option to go and talk to them about. All right. Knee replacements are a long way down the road, and that's not for this video. I can talk about them another time, but I just wanted to reassure you that there's so much you can do, and please don't just give up because you find the exercises that you've been given either not effective or too hard. Because if you really are struggling with that much pain, you want to be active, and you've took all the painkillers they take, go back to the medics and see the doctor or the physio and see if you can have discussion maybe about that. Because if you did and it worked, and there's no guarantee it'll work and there's no guarantee they'll deliver it, because it depends on your health as well, that's something for them to decide. But if you had it and if it worked and it gave you good pain relief, it's going to make your exercises much easier. But still consider all those other elements, because the inflammatory process is a whole body one. So eating well will help. The steroid injection into your joint is only going to help with the inflammation in that joint. There's a mild effect in the body, but not enough. Okay, so you'd still need to keep up with those other suggestions that I've made. Can you make it, the damage that's done, go away? No, but you can definitely slow it down, and not everybody gets to that stage. Some people will stay with mild or moderate and it'll never change. Okay, so just don't assume because you've got it, it's going to get worse, but just don't assume if you have it, there's nothing more you can do. All right. I hope you found that useful. I hope I haven't spoken too fast. But anyway, it was great to talk and great to share. I'll see you soon.